Aloha, my name is Leslie Ann Kikuchi, physical therapist and manager of rehabilitation services here at Kuakini Medical Center. On behalf of the staff here at Kuakini's Orthopedic and Spine Center, we would like to thank you for choosing us for your healthcare and surgery needs. Our interdisciplinary team, consisting of doctors, nurses, case managers, occupational and physical therapists, will work together collaboratively to ensure the utmost quality of care during your time with us. We will provide you with a brief overview of what you can do to prepare for surgery, as well as what you can expect during your time with us. This includes preparing your home, as well as designating a caregiver to help you at home.
This Joint Education Handbook is a valuable resource for you. It provides detailed information such as maps and directions, contact information, pre- and post-surgery exercises, and appropriate safety equipment. These handbooks are available at your surgeon's office or online at www.kuakini.org. In preparation for surgery, there are 3 important appointments to make note of: your pre-operative visit with your doctor, a pre-screening visit at ambulatory care services, and a total joint replacement class.
The first page of this handbook is useful for keeping track of these appointments. Keep in mind that these appointments may be scheduled on different days.
Some recommendations for preparing your home are to remove throw rugs, clutter, and extension cords from the floor. Also, make sure there is a clear path in the areas where you regularly walk. Have a chair with a firm cushion and armrest. A soft couch may not be appropriate. Keep in mind that you will need additional support for childcare, pet care, and daily household responsibilities during your recovery. Also, you should consider your transportation needs, as you will not be allowed to drive until cleared by your physician. Your active participation with occupational and physical therapy will help to facilitate the best outcomes for your recovery. Our experienced therapy team will work with you throughout the course of your stay with us. Depending on your doctor's orders and the type of procedure performed, your length of stay at the hospital will vary. Patients may leave the same day of surgery from our ambulatory care services or stay several days in a Kuakini Medical Center nursing unit. You may have to be fitted with intravenous lines or IVs, oxygen lines, drainage tubes, and/or catheters to hold your urine. You can expect to be on medications as prescribed by your doctor. You may also be receiving pain medications through an IV or taking it orally as a pill. Surgery and medications can affect everyone differently, so we advise not to get out of bed unless accompanied by a Kuakini healthcare team member. It is important to pay close attention and follow any activity precautions and recommendations, including weight-bearing status, use of a brace, and use of an assistive device. The Kuakini therapy team will reinforce these recommendations during their time with you. Physical therapists will come in for an evaluation either on the day of your surgery or the following day. They work in collaboration with nursing staff to ensure that your pain medication needs are addressed in preparation for activity. While at your bedside, the physical therapist will be monitoring your vital signs and pain management throughout the session. They will also assess your strength, coordination, balance, range of motion, and ability to get out of bed. They will assess which assistive devices will be most appropriate for you and teach you how to use them. You will learn about getting in and out of a car and climbing up and down stairs safely. They will also teach exercises that you can do on your own to help with your recovery. During your stay with us at the hospital, a physical therapist will initially work with you twice a day. you can expect treatment once in the morning and again in the afternoon. Another evaluation may be done by an occupational therapist who will ask questions about your home setup and support system. They will address your ability to perform self-care tasks, including dressing, toileting, bathing, and grooming after surgery. Strategies to safely perform your daily self-care tasks will be covered, and any appropriate adaptive equipment will be recommended. Examples of adaptive equipment include reachers, elevated toilet seats, and shower chairs. We recommend that you bring in your own set of loose-fitting clothes to use during your sessions with our therapists. The occupational therapist will determine if you will need continued treatment after your evaluation. If continued treatment is necessary, you can expect to work with occupational therapy once a day during your stay. In order to get the most out of your therapy sessions here at Kuakini, we highly recommend that your designated caregiver is available in the days before and after your surgery. During your therapy session, we will educate your designated caregiver so that they can safely assist you with your mobility and self-care at home. Here are different types of assistive devices: a front-wheeled walker and axillary crutches.
If you do not already have a walker or crutches, this equipment will be provided for you if you discharge straight home from the hospital. If you do already have a walker or crutches, please bring them with you to the hospital so that our therapy team can ensure an appropriate fit for your use.
The equipment listed here may be helpful for use at home during your recovery. These types of equipment may not be covered by your insurance. Local drugstores and specialty medical supply stores carry most of these devices. The therapist can provide you with a handout on different medical supply stores if you are interested. Here are some general exercises that can be done in preparation for surgery: armchair push, long arc quad, hip abduction, and straight leg raise. Here are some exercises that can be done after your surgery. Your physical therapist will review these with you at evaluation and provide you with an exercise handout: ankle pump, quad set, gluteal squeeze.
There are several discharge options available to you. The therapist will determine their discharge recommendations after initial evaluation. Case managers will obtain this information from the therapists and doctors to coordinate a discharge plan that is safe and appropriate for you.
Discharge option 1, you will return home and may receive home or outpatient therapy. For home therapy, therapists will come to your house, assess your home environment, and work with you there several times a week. If appropriate, you may travel to an outpatient clinic several times a week to receive therapy. Discharge option 2, you may receive rehab services at another facility. There are various facilities available that provide therapy at a pace that is appropriate for you. The case manager will consult with you regarding your preferences on where you would like to be transferred. You would plan to stay at those facilities and work with therapists there. As a final reminder, have your designated caregiver pack a bag for your time at the hospital, including a change of clothes that is loose-fitting and elastic, your joint packet folder for additional handouts, and any assistive equipment you already own.
Making the decision to have a joint replacement surgery is a big decision. As your support staff here at Kuakini, we want you to have a successful surgery and recovery. We're here to support you and your rehab goals.